Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. Yep, we're in studio. It's one of those days that we're not in studio, but we're still live. And we'll take all of your phone calls no matter what. 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. Perhaps you've tried, you've applied, you've done everything you can about whatever's ailing you, and you've come up with the same old nothing that absolutely works. Well, here's an opportunity to put the fire out, so to speak, and to try to figure out what you can do better without drugs, without surgery. That's why we're here, and that's why we do this program every Sunday. Make sure you keep telling your friends, and when you can't find us online, go to rosellecare.com. I have a very special program for you today, and one that hopefully you'll find that is a gift. It's a gift to me because I have a very special guest to start out with, somebody who I've admired for more years than I want to think about. He is the past chairman of the International College of Applied Kinesiology, this very special group of eagles, the best of the best in the world. These doctors do things that just are tremendously amazing. This man is a guy who has taught me so much and then had the audacity of handing me the flag to carry this organization starting last year. But having said that, I'd like to welcome Dr. David Leaf. David, thank you for being on the program.
Well, I'm glad to be here.
It's a fun program. We do this on a regular basis every week for a whole lot of years. And we have a very, very educated group of listeners. And sometimes they throw things at us that, we have to answer in a very different way, challenge them a little bit. But today what I want to do is I want to explain the specialty that you and I have been involved in, loved, and have given our professional careers to, applied kinesiology. And, if there's a master around, there's very few names that come to the surface, but you're definitely one of them. David, for our listeners, the area of work that you've dedicated your life to, applied kinesiology, can, in a very simple, straightforward way, what is it that we deal with?
Well, we try to really look at a patient, find out why they're hurting, why they have the symptoms they have, and what we try to do is take the different tools that we have and fit it to the patient. It's like I've said many times, most doctors, if you go to a surgeon, they're looking at what to cut out. If you go to a doctor who basically prescribes medications, it's what medication do you do to do this? Typical chiropractor, what do I have to go in the spine to treat? What we're trying to look at are all the different facets and try to find exactly what is appropriate for that person. Now, whether they're 80 years old or they're 5 years old, there are usually way more factors than just one thing wrong with them. The problem with the medical model is they look for symptom A equals a drug A equals diagnosis A, and so often there's so many other factors that are involved in it that they only get halfway results and the patient doesn't respond the way they should.
If you'd like to ask Dr. Leaf a question, 888-630-9625. That's how you make that happen. We're talking about an area of application, an area of diagnosis, an area of therapeutics called applied kinesiology. Kinesiology standing for muscle function. It's that applied piece, David, that a lot of people don't get. We have multiple tools, and we look at things from a metaphor of what we call the triad of health, or structural, representing things that can happen injuriously to the body, the biochemical system, things that are outside in, and the emotional system, how our mind works in relationship to our physiology. But that applied piece, that applied kinetics, that applied kinesiology, what is that really?
Well, I think sometimes it's best to give an example from patients. One of my patients years ago was one of the top marathon runners in the world, and in his mind, he felt that he couldn't win against Alberto Salazar, who was the top runner at the time. Unfortunately, or fortunately for him, he could run the same course another year and beat Salazar's time. And I would say to him, now what's wrong? He'd be running right next to him, and just before the end of the race, Salazar would speed up and Bobby quit. He, in his mind, had already lost before he started. And if we want to talk about applied, you could try to treat him, give him the best nutrition, give him the best of everything. But on the mental side, he knew he was a loser against that one person, and that was the thing that you had to change. You could do everything else the best you could, but there's an example where you started to talk about on the mental side, where some people have that in them, and you've got to change that, or you're never going to get the person fully better.
You know, when a patient comes in our office and we begin to look at them from their symptomological representation, they've got a bad shoulder, they've got a bad knee, somebody comes in, it's swollen, and, take somebody who's a woman in her mid-40s, and she's complaining, I have a difficult time even walking upstairs anymore. I didn't do anything. I haven't gotten hurt in any way. And we test different muscles. We test the big thigh muscle, the quadricep, and that weakens. And, she looks and she says, I don't know why that is that way and compared to the other side. But we know that every muscle in the body has relationships, if you will, to other systems. And they have a lot of different things in common. How do you go about explaining to a woman that that sore knee that she has is not necessarily an orthopedic problem, that it can be initiated and stemming from something else?
Well, during your examination, as you go through the patient, you start to see what they're doing. And I'll backtrack just a little bit. I always say to my patients that many patients adopt their injuries. You've hurt yourself in the past, you have something, you change your behavior, how you do things, and now you continue to do that, and you slowly wear that down. The problem is that the initial cause of that weakness in that area can run the gamut from an old injury that they had ages ago and they modified their walk. It could come from just carrying a child on their hip, for having 3 or 4 children carried on their hip, how they carry their purse. And we also know that even things like intestinal problems and things can cause a reflex weakness, which will affect a series of muscles. So when we look at things, I'll say to the patient, look, my job is to get that muscle going and functioning. Your job now is to keep it going and finding out what you do in your lifestyle that causes that weakness or that inhibition to come back again.
888-630-9625. That's how you reach us today. My guest today, Dr. David Leaf, one of the most brilliant applied kinesiologists in the world, as far as I'm concerned, a guy who's taught me a tremendous amount over a period of years that I've had the pleasure of knowing him. I have his undivided attention today because we're just breaking up a International Applied Kinesiology board meeting, actually here in Virginia, but we're not in the studio, so we're close by. You can still talk to us. David, we're talking about an area of clinical application, if you will, that far supersedes virtually anything, in my opinion, that's out there, because we can take situations, conditions, symptoms, and begin to turn them around quickly, in sometimes a matter of moments. So you have somebody that comes in, and let's go back to that knee problem, and the doc says, you need a total knee. When is that really necessary?
Well, you run into that where they have totally worn the knee out, but so often there's still some cartilage in there. It comes back down to that muscle function. The first thing you've got to do is to normalize how the person walks and try to make sure that they don't get into some limping gait. So many people, when you watch them, you ask them, they'll trip over their feet, they'll trip over a door frame. Their mode of walking is such. I say to them, it's just like you're driving the car and the front end's out of alignment. Keep going. You're going to wear the tires out. Well, you can buy another tire. But knee replacements, they're not all that great these days. They're getting a little better, but they still leave a lot lacking. The problem is trying to normalize that. And when you talked about that thigh muscle that doesn't work, a very common thing that people have is that their kneecap just doesn't move. Your people at home, if they put their leg out straight and apply pressure, they should be able to move that patella back and forth easily. And if it doesn't move, then that quadricep muscle, that thigh muscle, doesn't fire as it should. Now you start breaking down that knee way faster than you should.
So my question, David, to talk about that patella for a minute, a lot of patients will come in and they say, my doctor said that my kneecap is shifted to one side, or it's not tracking, the way it's supposed to. What came first, the chicken or the egg? The knee problem, the patella not moving, or the muscles around it not firing? Well,
I look at that patient and I go, look, your knee's caught in between your ankle, your foot, and your pelvis. You got a chronic imbalance in your pelvis or your hip area, you're going to have a problem in the knee. You got a problem with a dropped arch in your foot, you're going to have a problem with the knee. The knee is caught in that middle, and if you're just going to look at that knee, you're like that blind man feeling the elephant. You just got to hope that you're not behind the elephant. You've got to look at the whole chain of it. Now, ironically, when I dealt with, I'm thinking of a New England Patriots player that I dealt with chronic leg problem, and it turned out to be a jaw problem. Now, sometimes you've got to go all the way up to the head. If you have a jaw problem, the TMJ problem, it will affect how the muscles work on that whole side of the body. They'll have a shorter stride. People start to trip over their feet. So you may actually be looking at, and sometimes it's hard for the patient to understand that you got to look at how their teeth are glued together. Do they have a jaw problem in order to fix their leg problem?
Truly, the knee bone's connected to everything else.
Well, everything in the body is connected to. When I went to college, the president of the college had written a book called "Anything Can Cause Anything." And unfortunately in the body, that's about it. And if you have a limited scope of what you're looking at, you're going to miss so many things.
When you deal with a patient, particularly in our practice, they've come in from so many different venues. They've been to every doc that you can possibly think of. We see some very, very ill people. And they've been told that, what do you expect for your age? You learn to live with it. Your body's gone beyond a place of repair. Take these pills for the rest of your life. And you see similar patients, and you see some very high-level top performers, and you see, the same type of patient that we do. So when a patient comes in and they're on all these medications, and you have a problem, an extremity problem like we're dealing with that we've been talking about for a few minutes, where do you begin when it's so complicated? Simply because you got lifestyle, you have medications, you have other input. How do you get this patient to understand that you have to start taking layers off, but they can experience results if they follow through almost immediately?
Well, again, one of the advantages that we have is that you can show an immediate change on the patient. You go to a doctor and he goes, well, your knee hurts, take this anti-inflammatory. And they've got to take the pill and they've got to wait, and it works, and maybe that one doesn't work so well, so you go take another one. When you're in the office and we start to work on something, the patient can see a result immediately. Oh, that muscle that wasn't working now functions. Now walk. Let's change that walk. Or you find that there's a nutritional imbalance and you chew up a tablet of something and suddenly some pain is diminished dramatically. And you can also show that if you take a substance, caffeine, or if you're a smoker, nicotine, and bring the pain right back, you have a way of educating the patient to both the positive and the negative about what they're doing. And that lets you tie into the patient and help the patient understand faster that they're in control of how they feel and what their response can be.
888-630-9625. My guest today, Dr. David Leaf, an amazing chiropractor, applied kinesiologist, one of the most amazing clinical doctors in our profession, in our field. I want to remind all of you that this week, starting today, the 11th, National Health Week, and the Roselle Center for Healing, in conjunction with Caring for Others, 501c3 Foundation charity, is extending an opportunity to you. Those of you who have listened to Dr. Tom Roselle live for perhaps a decade or so and have yet to make that decision to come in to see one of our very qualified doctors, I'd like to encourage you to do that. Here's an opportunity. All you need to do is call our office at 703-698-7117. That's 703-698-7117. And tell our staff that you'd like to register for a consultation. This is not examination, but a consultation only. Our doctors are going to extend their time this week to be able to donate to you for a $49 donation to Caring for Others. I'd love to have you do that. Give us a call and get that happen. Dr. Leaf, David, thank you so very much. I appreciate you. I appreciate your time. You're an amazement to me and someone that I model after. Thanks, David.
Well, thank you, Dr. Tom, and you also are one of the best diagnosticians and therapists in this country.
Thank you, David. Appreciate it. We'll be right back after these messages.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are not in studio, but we're very live. We're here in Virginia. We're at a board meeting, International College of Applied Kinesiology, and I got handed the gauntlet to carry this organization in the next couple of years. Dr. David Leaf, who was our guest, and David's off catching an airplane and flying back to New England. It was a pleasure, but we have another guest, somebody else who has stepped up and positioned herself in a way to take this board and this organization to a much higher level. Dr. Nancy Dorio, welcome.
Thank you.
I'm glad that you're here for a lot of reasons.
Yeah.
Listen, all of us have our specialties and our interests within our own field, and I know you do as well. And it's one that's very profound. It's one that most people only look at when they get sick. But the truth of it is something that we should all look at early on. Tell us a little bit about. I know you like immunological problems. Tell us a little bit about that and how you approach those things.
In my practice, the patient's overall health, inflammation state, pain, and ability to improve their situation is closely tied into why they're not feeling well. They might have pain, they're not sleeping well, they have to come in and get some help, nothing else is working, or they've exhausted many avenues, and so they'll come in to learn things that they might be able to do in their own lives that can make the changes they want.
When you're dealing with a patient and you're looking at them, you go back historically and you look at them from a place of vaccines that they've had and what exposures they've had, where they lived, and so forth?
We'll go back even farther than that, looking at genetics, what they may have been predisposed to in their family history, and work it forward. Yeah.
So that's all carry through.
Absolutely.
We have a caller right now. We have about 4 minutes, and we'll take it for a very quick, because it's right up the subject that we're talking about, in immunological disorders. And from an applied kinesiological point of view, we can look at these things very specially in a way that answers the question how things broke down to begin with. So, Bobby, are you still holding?
Yes, I am.
Hello.
I'm here.
Hi. So what's going on? Tell us. Got a couple minutes.
Well, I met a lady recently, and we were conversing, and she told me that her daughter-in-law had gotten a vaccine in the Army for anthrax, and that had developed, and I'm sorry I didn't note the name of the syndrome, but it had bar at the end of it, And now at 28 years old, she has to use a cane to get around, and she's, very debilitated. And having listened to you over the years and knowing that you have many remedies or ideas for things that can help many of these situations, I thought you might be able to direct me to direct her as to how her daughter-in-law might get some help.
Well, the anthrax vaccine was developed actually a whole lot of years ago. It goes back to the 1930s in the Soviet Union, and they started playing with it first, and it first used in humans in the 1940s. So it's one of those things that has a tremendous amount of side effects. So, what I want to do is I can talk about it very specifically. Where does she live, do you know? Colorado. So I actually have a doctor that we're going to talk to when we get back on the air in the second half, who is with me, part of my board, who is from Colorado. So we'll have a referral for you. Anyway, Dr. Nancy, let's kind of handle this from the basis of here's somebody who was in the Army, got an anthrax inoculation, and now has the syndrome, the anthrax syndrome. How does that happen? Why?
Well, we're looking at the irritation that the cells in the body are being triggered by. So the irritation in this case would be a vaccination. The body mounts a response, and the symptoms become apparent based on where that individual's body is taking them, based on either their history, their lifestyle, their overall immune status to begin with before the vaccine happened. But primarily what we're looking for is how do we stop the symptoms from continuing to play out, and which area do we have to address? Is it inflammation? Is it their barriers? How's their stomach? How's their digestion? How's their immune system? We just take a look from all areas and figure out what will manage the trigger in that individual person.
Bobby, that syndrome, by the way, just, I didn't mean to ignore you. It's called a lot of things, but one of the things it is called is the Gulf War syndrome. And a lot of our warriors came back with that type of problem because they were exposed to so many different things, but it came as a result of many of the things that we did to them. And, you end up with problems with brain injury. You end up with problems with neurological gait patterns, meaning you're in the walkers. You can't feel anything. You actually will lose cognitive function over a period of time. And all of this has to do with the body's immunological response, Dr. Nancy, that causes these things to come about, or the inability of the body to handle certain things like this. I wish we had more time. I'd love to go on and really answer this question more in-depthly, but unfortunately we can't. That's limited time. And I know that you've got to get out of here, and as well as the rest of our board members, but I want to thank you very much for taking 2-3 minutes and being on the program with me. Thank you.
Thank you.
We're going to take a break. We're coming up to the news and some very important information. Don't go away. This is Dr. Tom Roselle. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're not in studio, but we are live, and we can take your phone calls. 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. We're kind of doing a potpourri of different types of inputs from really brilliant doctors, and you've heard from two. We're going to have a couple more. I have a guest coming up very quickly now, Dr. Scott Cuthbert from Colorado, up in the mountaintops of beautiful, beautiful country, places that I like to go to ski. I just never get there in the summertime, and I should, right?
It's beautiful, absolutely beautiful.
It's actually gorgeous out there. It's heaven, except when it snows.
Yeah.
And then you get buried forever.
And we've been having flooding, tremendous flooding recently. There was a huge fire in Colorado Springs, and there was flooding. And when I drove to this meeting here in D.C., almost got washed out. It was from the water coming down.
That's not a good thing ever, Scott.
No.
That's not good.
We've had 7 years of of drought in Colorado, and this sudden rain has really helped the state. I'm sure everybody there is going to be happy to.
Well, let's talk about side effects of runoffs. No, we'll get to that place in a second. Actually, I'd like to pick up a little bit more on this anthrax conversation that we had with our last caller. The Army does some things that are, in my opinion, that are unconscionable to our soldiers, our warriors out there. And not only do they have to go put their lives on the line for us to maintain our integrity, our freedom, but they put their lives on the line simply because of the huge numbers of inoculations. Many times they become the test tube. they become the petri dish of investigation. And I'm probably going to get myself in a tremendous amount of trouble saying the things I'm saying, but you know what? I really don't care, because we need to know about this. And you sign your life away, when you're in the military. I was in the Marine Corps, and you get a whole bunch of things. I mean, I remember when I went down to Quantico, Virginia to go to boot camp at officers training camp, and I stand there and there's two Navy corpsmen, one on one side, one on the other, and they have these air guns, and, I've got tremendous numbers of inoculation in one arm, another in the other, and then I get one in the back end. And that's how I started, my welcome to Quantico, Virginia, and my training. However, these guys are getting even more than that today.
Yes.
And the adverse reactions to anthrax, and we'll just talk about that one, is 40% and up to 70% in women. 40% in men and up to 70% in women. And the symptoms vary from ALS conditions to Lou Gehrig's phenomena, actually can begin to cause it over a period of time. Tremendous numbers of neurological disorders, and even death and seizures. Dr. Scott, I said that I was going to refer a patient to you. So this last patient, if she tells her friend, you're the guy that she's going to see.
Sure.
How do you handle something like this? And can you begin to turn things around? Is it possible?
I've seen a lot of patients who've come from the Gulf War. I serve a lot of patients at Fort Carson. They come down to see us in Pueblo. And those patients a lot of times have neurodegeneration. They have problems going on in their nervous system, which are reflections of things like stressors, like inoculations, exposures to incredible heats for 6, 7, 8 months, poor food, stress, etc. And all of them manifest themselves in the nervous system, and applied kinesiology allows us to uniquely identify the source in the nervous system of these degenerative processes. And so my job always with patients who've suffered from Gulf War syndrome, or from people who've gone through incredible stresses from fighting our battles overseas, is to rebuild their nervous system, and it can be done nutritionally, structurally, and dealing some with their emotional factors that are really changed. I've had a number of patients who've had astonishing emotional trauma that they're still living with, which is a fundamental generator of discomfort and disorders in their body. Addressing those in a unique, natural way can change the game for these people.
888-630-9625. That's how you reach us here. That's how you talk to us and ask any question that you like. If you'd like to get a hold of us offline, you'd like to get a hold of our office to ask any question that you have, you can do that very easily by going to rosellecare.com, ROSELLECARE.com. My spelling's not so good. It's been 2 days of a very difficult board meeting, and my brain is on overload. But it's your fault, Scott. I mean, it's you and the other guys that have been here. It's like craziness. Anyway, dealing with any patient, particularly a patient that has been exposed to inoculations. Now, we know the inoculations by themselves have a lot of ugliness in them, from the preservatives, the stabilizers, something that we call thimerosal, and we know that's mercury and has a tremendous effect. There's aluminum in these things. There's stabilizers that are basically a catch basin of all kinds of nonsense, and they cause damage. But when you get the anthrax bacillium, this bug that they put in you to try to stimulate, and we know that the side effects are huge, and we're talking that women in the military suffer, 70% of them have some sort of symptomological reaction if they've had this vaccine. How do you go about figuring out that this is what it was? What would you do with a case like this? How would you begin the process?
I'd identify the component of the nervous system that's the most broken down. There's a way to do that in applied kinesiology. And there's a way of finding out what element, natural or medicinal, will create the immediate improvement in the lost function. Rebuilding the degenerative nervous system involves a number of nutritional approaches, a number of physical and structural approaches, and doing that can bring back somebody who's got an extreme, relatively recent onset neurological problems. You can't change ALS in a fundamental way. It's very difficult, but things that are just the beginning, let's say, of this patient's anthrax side effects can be definitely dealt with, and she could be made so much better. I've treated so many patients with cancer, with in-stage cancers, and made their life much more comfortable in the last few years. I don't save their lives, but I change them. And all natural physicians can do that. They can make their patients healthier, better, even on their course to death.
It makes me crazy to see traditional allopathic treatment of so many of these conditions simply because of the fact that they go after the body in a way that they're trying to kill something. And the problem is that they're killing the body's ability to repair itself, to restore itself, to begin to have an immunological reaction and function against other things. Mm-hmm. And so they go down the tube even faster. The dignity of that patient is totally destroyed. In the work that you and I do and the doctors that we serve around the world, there's a different way. There's a way of looking at the why is that, if you will, knowing, that these patients have an underlying something that's causing it, treating that, getting the patient's cooperation, educating them to a level where they understand that there's a detoxification that has to be done, that it can't be done just a little bit if they want to save their lives. You saw our PBS special, Ageless Health, and there were 6 patients there, and several of them had very severe problems. A young girl with MS that was progressing and demyelinating when we saw her on all kinds of medications. So the traditional community wants to give her steroids and autoimmune suppressors, and which she was on. And, she comes in and we start looking at getting her off of this stuff and allowing her body to begin to repair itself, pulling out the poisons, the heavy metals that were in her, the environmental pollutions that had settled into her fat cells, her hormones that were crazy. And then we began to see the body change day by day, month by month, to the point where she was totally able to resolve things. But we need the patient cooperation.
Yes, we need to remember about every patient that they are alive. They are the healer. This is the source of where this recovery is coming from. And if we feed the patient, if we fix the patient, if we make the patient stronger, they'll overcome almost anything that they face, including astonishing number of diseases. My recent textbook lists almost every applied kinesiology research study ever done that's cured a patient of any condition, and it describes them all. The amount of research backing the methods that you and I use is almost inexhaustible now. It's been going on for 50 years straight. The number of healthy, improved, recovered people that applied kinesiology has brought about in this world is truly remarkable.
See, I want my listeners to know that I'm talking to the think tank over here. This is the guy that is not only on my board, but he also is the head of the education research piece of our organization and keeps everybody on track. It's like a walking encyclopedia to talk to this man. If I want to know something, I pick him up or I text him, and I can get all kinds of data. And I really appreciate you, Dr. Scott. Your amazing contribution to this organization. It's been my pleasure to have served with you all this time, and hopefully together we'll take this organization at a much higher level, but for one singular purpose, and is to allow people to reach for something without drugs, without surgery, through the things that we do with manipulative modes and nutrition and acupuncture and all those things, when brought together in a singular platform, are exponential.
Only a few of your listeners know how blessed they are to know who you are over the radio. I hope they all come and see you. You're a remarkable gift and man to this community.
Dr. Scott, thank you very much. I appreciate it. Thanks for your time. Thanks for sitting in. Coming up this week, starting today, the 11th of the month, August. We're already, kind of tiptoeing through the end of the summer. But it's National Health Care Week. And what we want to do is we want to work with our foundation, Caring for Others, which is a 501c3, and we would like to extend an opportunity to you. And that opportunity is simply this. If you'd like to have a consultation, just come in and talk to one of our docs. Take some time coming in, and what we'll do is we'll do a preliminary examination, which we're going to do an acupuncture graph on you. We'll do a gait scan so we know what your patterns are, and then we're going to get some blood pressures and then our docs will sit down and talk to you for 20 minutes. And if you want to proceed after that, then it's up to you. If you want to go into an examination, you can. But 20 minutes, actually, of the doctor's time. And what we're asking for you to do is no money to us. We don't want your money. We want you to donate $49 to Caring for Others. It's a 501c3. You get an immediate tax deduction for that. And you'll find out whether it's something that can be done for you without drugs, without surgery, without going through the examination process. But we're doing that this week for National Health Care Week, and you can participate by calling 703-698-7117. I love doing this program because I get the opportunity to not only talk to you, but talk to other doctors and to get their perspective. And since we're on the roll today and we're talking about applied kinesiology, I want to talk to one of our teaching diplomates, a guy that is also on my board who is from the other end of this country. He's from the West Coast, and we're going to kind of carry him over into the last segment because we've only got a couple minutes now. But Dr. Hank Tolhurst. Dr. Hank, welcome.
Thank you.
So you have a very specialized practice, and if you want to talk about, the things that happen to people, I know you have a little story, and I don't want to get into depth in it, but you ended up, and you're a remarkable man because you recovered substantially from this thing. But I keep telling my patients, mercury kills people, and it almost did you in as well.
That's correct.
What happened?
Well, I had 8 amalgam fillings in my head from when I was a kid, and as a middle-aged adult, some procedures were done that made that amalgam material get into my body through my lungs and actually get into some of the tissues in my breathing area, and my body reacted in such a severe way that it degraded most of the nerves in my arms and legs, and I did recover, but the pathway to recovery led to some remarkable understandings of how the human body works, and I love sharing that information with other people. It has to do with our human condition at this point in our culture, and you were talking about thimerosal and the vaccinations and stuff, and one of my key things is if you are planning to have a baby, so to get the mom cleaned out, and then
they work from there. Yeah. We're going to talk about it, and I know that's a very emotional trigger for you, but we have to take a break. We're coming up to the news. We'll spend a couple minutes after the break talking just a little bit about the ramifications. But you're an amazing human being. You're still practicing full-time. You're a member of this board. You're putting in, you've seen firsthand the damages that can be done, but you also know what recovery is. We're coming up for a break and some very important information. We have to pay respect to the people who pay for Dr. Tom Roselle Live, so don't go away. We'll be right back. This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle Web Store. That's drtomroselle.com and click on Roselle Web Store.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We've been very interesting today, I think, bringing you some amazing doctors as guests on the program. I'd like to remind you, if you'd like to reach us offline, it's real easy to do. You can call us at 703-698-7117. And by the way, that's how you register for a courtesy consultation with a $49 donation to Caring for Others, as well as going to rosellecare.com and send me a note, because I'd like to answer all of my inquiries personally. So please do that. My guest right now, Dr. Hank Tolhurst. We're talking a little bit about what vaccinations can do relative to damage of the body. And Dr. Tolhurst had suffered some problems himself, but he's a remarkable, remarkable human being, one who has turned his life around. Dr. Hank, let's talk a little bit about the effect on the body, what happens. I know you want to touch on the liver a little bit. Let's take it from there.
Yeah, I was amazed to find out that there aren't just one or two types of toxins that can contribute to a cataclysm, an immune cataclysm. It has to do with adding things up. I always like to use the old Batman movie where Jack Nicholson put one type of toxin in one product and another toxin in another product, and it wasn't until you had three different toxins together that your body would completely fall apart. And what we see in pregnancies and in newborns is that there are many things that enter the body that stay there and end up as part of, contributing to things that don't allow proper development. I think one of the more interesting studies that came out was that there were 2 tampering cases with acetaminophen products. That basically, once they were taken out of the marketplace because of federal mandate for a short period of time, during that same time the rate of autism dropped dramatically.
Isn't that amazing?
Yeah.
Yeah, and people don't get that. That's not the information that is released, willingly.
Yeah, and so last year, and again, we can say this, but the makers of the infant drops of Tylenol just took them off the market. It was a very quiet move on their part, but they said something along the lines that, well, it may not be safe for the liver. And that would just be one of a number of things that could add up. We've looked at, in the autism world, mothers taking certain types of medications, especially antidepressants, things that can gum up the process of the liver. The liver has to make the molecules that go to form the brain. And we need to make sure that those pathways are very delicately managed during a pregnancy and during the child's development. Putting massive quantities of vaccine in, as you were talking about with Dr. Cuthbert, are the things that can create, a breakdown of the most important parts of things. So be careful.
We're very careful. Dr. Hank Tolhurst, my guest on Dr. Tom Roselle Live, and we're here for you no matter what your problem is. All you need to do is get a hold of us at drtomroselle.com or rosellecare.com, or call us at 703-698-7117. We'll see you next week, same time, same old place, with more updated information, just especially designed for you. This is Dr. Tom Roselle. See you then. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.